Hello, in this video I'm going to be talking about the role that your personal preferences play in your breast cancer experience. Before I go on, I'd love to invite you to subscribe to our channel. It helps you see the new content we put out every week. And just a reminder, you can go to your Yerbba.com to get your personalized report. And I'll be talking really briefly about that in just a moment. So patient preferences, it's kind of funny to think about you having choices when you're undergoing treatment for breast cancer. But it's really important that you know that you need to be an equal partner in the treatment that you receive. A lot of people have written in the comments to us that they weren't given a choice. And there are certainly some things where we just know this is the best treatment. But you have a choice from the doctor you see to where you get your care. For lots of people, that may not be the case if you live in a remote area, or you have difficulty with transportation, or you have limited panel of doctors you can see because of your insurance. But even in those cases, don't rule out the possibility of going to where you really want to get your care. That office can help you make things work. So your preferences start with where you get your care and continue with the type of surgery you're going to have, whether you have reconstruction after a mastectomy or not. In some people, the benefit of certain treatments is smaller. So for some people, the benefit of radiation therapy is lower than in others. For some people, the benefit of systemic treatment is lower than in others. I think it's really important for you to understand the rationale for a certain treatment being offered to you. So if somebody recommends or offers chemotherapy to you, you have every right, and I would welcome you and invite you to say, what's the benefit? Is this really going to reduce my risk, or is it going to reduce it a little? Because the benefit depends on actually your particular tumor characteristics. You know, while we may say no tumor is identical to another, even more important, you are not identical to another person. So your tumor, yes, might be different from the person last seen, you know, the person before you in your doctor's office, but you are most certainly unique, and you have history behind you, and you have certain things you want to do ahead of you that are completely your own. So letting your medical team know what's important to you and knowing that that information is available to you is so important. A lot of people in the comments have said, what is the benefit of this treatment? And while we can't say, because we're not part of your care team, we can help set up the questions you should ask of your medical team, or the questions you can ask. And if you bring them in written down ahead of time, it's more official, and your medical team will actually appreciate that. Your preferences matter because if you don't know why you're getting something, it makes it harder to go through it. If you feel you don't have a choice, it feels more, you feel less powerful. And I think we give up our power a lot when we have a serious illness, right? You're told where to be, when to be, put this gown on, you know, go here, go there, get this test done, and, you know, office doesn't have room for you to get your treatment on a certain day. You need to feel like you are fully informed and that the things you care about are heard by your medical team. I hope this makes sense to you. Even if your medical team seems as if they're saying these things are not choices, they're always choices. There are always choices. There are choices, and this to me is really interesting. Let's say you're on something for 5 years. You're on a medication for 5 years. You're going to decide whether to take that medication or not, a fully informed decision. You also decide every day whether you're taking it or not. So you can start on a medication and realize you feel miserable on it and that you'd rather not stay on it for 5 years. That's a choice to take the medicine that day. And it's a choice and a preference to bring it up with a different person on the medical team, maybe the nurse, instead of the physician if you don't feel as comfortable with the doctor, or similarly with the doctor if you're not as comfortable with the nurse. So this is why I'm being really firm about your preferences matter. even if you decide to do what's offered, at least you feel informed. So Yerbba.com has a personalized report for you that shows you all the things that might be offered to you. It's not medical advice, and it's not a roadmap or a treatment plan. Rather, think of it, if you will, as a menu. These are the things you might hear about. And if you don't hear about something that's on the Yerbba report, now you've got something you can use to ask those questions. Our reports are all written in language that's easy to understand. It's written in layperson's language and also has enough detail to be useful if you have a medical background. So it's not dumbed down, because you're not dumb, but we try to make it as crystal clear as possible. Your Yerbba.com report will also tell you the advantages and disadvantages, the pros and cons of different treatments, including the short-term side effects, the medium, and then the long-term side effects, and how severe or how common they are. So it's quite detailed, and you can also choose not to look at all that detail if you just need the broad strokes. And it's personalized to you based on everything in your medical records. So, check it out, see if it's useful to you. I hope this video has been helpful. Really, my goal has been to emphasize the importance of your voice and your preferences and your questions in getting high quality, values concordant information. So in my opinion, those treatments, those attributes of information are as important as the treatment itself. So high quality information in a way that lets you look at what's important to you, more important than other things. If this has been helpful, click like and subscribe. You can drop a comment or a question below. And as always, thank you for watching.